Hello, and thank you for joining us this afternoon for this important discussion about Parkinson's disease, early signs, and what you need to know. You know, more than 10 million people worldwide are living with Parkinson's disease, which we call PD. While the actual number of African Americans with PD is unknown, it is clear that there are racial disparities in the access to healthcare, diagnosis, and treatment of PD. Please join me in welcoming Arita McCoy, nurse practitioner at Johns Hopkins Parkinson's Disease and Movement Disorder Center, for this much needed discussion about Parkinson's disease.
Thank you so much, Jacqueline. And I'm going to go ahead and share my screen with everyone. So hopefully everybody's seeing that okay. Again, my name is Arita McCoy. I'm a nurse practitioner at Johns Hopkins. I'm actually coming to you guys today, presenting this information on behalf of the Parkinson's Foundation. We actually are one of their centers of excellence and, think it's a really great opportunity to just give great information about what Parkinson's disease is and how to detect it if you're curious or wanting to know what signs and symptoms to look for early. So I think first it's a good idea just to talk a little bit about what Parkinson's disease is. And Parkinson's disease is a progressive disease. It is also chiefly a neurologic disorder. So it affects the brain chiefly. We're talking about the midbrain. And in the midbrain, there is an area called the substantia nigra, which contains dopamine cells, dopamine neurons. And those neurons eventually, over time, very gradually start to degenerate for reasons that we don't quite understand yet. The important thing about dopamine to know in Parkinson's disease is that it's a neurotransmitter. So it sends chemical messages all throughout the brain. But chiefly in Parkinson's, the problem that we're having is how those reduced number of dopamine neurons affect movement. So we see that movement can become reduced, coordination of those movements become difficult. And also emotionally, we've learned that dopamine is really important in regulating our emotions and our mood. So these are the main issues that we're talking about when we talk about dopamine dysfunction. This slide is just, a really good range of people who we know have been affected by Parkinson's disease. And so as you can see, Parkinson's disease does not discriminate based on age, based on race or socioeconomic class. Of course, we know that people with Parkinson's disease, we're usually diagnosing it later in life. So between the ages of 55 and 65, average age of diagnosis is about 62, but we do have some outliers. It's really important to know that, as we all know, Muhammad Ali died with Parkinson's disease, as well as Janet Reno, who was the Attorney General of the US for quite some time. Also Jesse Jackson, who's currently living with Parkinson's disease. I think some individuals know Michael J. Fox. They think of Michael J. Fox when they think of Parkinson's disease. He actually was diagnosed pretty early in his life at the age of 29, which is a little bit rare, but represents the young onset or early onset Parkinson's disease population. So about 5 to 10% of patients are diagnosed prior to age 55. We also know that Colin Powell died with Parkinson's disease more recently, and then also Pope John Paul also had Parkinson's disease. So again, just to show this affects people all over the world throughout all different cultures, all different classes, but specifically we want to focus on Parkinson's disease and how it affects the Black community. So in the Black community, we are less likely to be diagnosed with Parkinson's, but the question is, why is that happening? And some early research has started to tackle this question and really understand what we need to focus on specifically in our culture. First, we do know that, we are underrepresented in the healthcare system in general. And that's just something that we've known for many, many years of time. But in Parkinson's disease, this leads to underdiagnosis of the disorder and also delays in the diagnosis. So we find that compared to the majority counterparts, that we are diagnosed about 4 years later and at a more advanced stage where more things are affected. And unfortunately, that can, prevent quality care from being given at an earlier stage. So it's really important just to know what we're talking about when we talk about the symptoms of Parkinson's, so we can start to recognize them earlier and then start to intervene earlier. Of course, we know that there are also some genetic differences, which we're learning more and more about every day. The Parkinson's Foundation is working on this specifically, but those genetic differences end up changing the way that Parkinson's disease may pass in family lines, but also how it may affect certain cultures more than others. Of course, we also know that because of the symptoms of Parkinson's, which we will go over, there's underreporting of those specific problems to primary care physicians and neurologists, because sometimes it just looks like what people may think is a normal part of the aging process. And so because of that, we really want to make sure we're highlighting what these main signs and symptoms are so we know what to look for as time goes by. Many people wonder, if we are dealing with Parkinson's disease, and we know that Parkinson's disease can impact people, what is the reason that we should get diagnosed earlier? Why is that important? We don't have right now a way to modify the disease progression, to slow it down or stop it. That is a big area of research focus. But because we don't have that, the reason that we want to get detected earlier is because we can start to improve care as early as possible. Thankfully, we have experts who change the way that Parkinson's care is delivered. So in the neurologist landscape, we have movement disorder specialists. These are neurologists that have spent extra time in training on learning about Parkinson's disease and other movement disorders and are great to have on the care team. We have physical, speech, occupational therapists, nurses, social workers, other therapists, dietitians, so many people who spend specific time learning about Parkinson's, and building that care team as early as possible is important in managing the disease as long and as well as we can. Also, developing that treatment plan and being able to follow it over long periods of time is extremely important. And so all of that just leads into better longevity, better quality of life, and better diagnosis of the disease and management over time. So just talking a little bit about recognizing the symptoms, we'll go over the symptoms that are important to look for, but it can be difficult to tell if you or a family member or friend has Parkinson's disease because these symptoms develop very slowly over time. We talked about how Parkinson's disease is progressive, so it may start off as a relatively mild problem, but then those symptoms may progress to get a little bit worse and really start to impact everyday life and activities of daily living. It's also really important to know that when you've seen one person with Parkinson's disease, you have seen one person with Parkinson's disease. Even in families and people who have, siblings or social network, people in their social network who have Parkinson's, we find that the progression is very different and individualized. So when I'm going over the signs and symptoms that we'll discuss, just know that if there are more than a few of these symptoms present, that might be a reason to make an appointment with your primary care provider or neurologist to talk a little bit more about what's going on. So one of the first and very early signs of Parkinson's disease is loss of the sense of smell. We call that hyposmia. And we are finding that this is present for many years, maybe even decades prior to any of the first movement-related signs of Parkinson's disease popping up. Loss of sense of smell usually is something that people think is just how they are. They've never really smelled things quite well. Their family members or friends might tell them that things are going bad in the refrigerator, that they don't smell. They have no problem changing kids' diapers because they don't have any problem with the odors that are detected, may not smell foods cooking as much in the kitchen. And so that is something we are finding can be a very early sign of neurodegeneration, not only in Parkinson's disease, but also in other conditions like ALS or Alzheimer's disease or multiple sclerosis. We're finding that loss of sense of smell is a very early sign that some changes are starting to happen in the brain. We also have trouble sleeping as one of the early signs of Parkinson's disease. And this trouble sleeping isn't something like insomnia, like difficulty falling asleep or staying asleep. This specifically refers to a condition called REM sleep behavioral disorder. And in REM sleep behavioral disorder, we all have 4 phases of sleep. And the last phase, our 4th phase, is REM sleep. That's actually when we're dreaming. And when we dream, there's a switch that's supposed to automatically flip in our brains that keep our bodies from moving while we're dreaming so that you don't act out what's actually happening in your dream. But in REM sleep behavioral disorder, what happens is that switch does not turn on. So people tend to do what's happening in their dream. Some people have spouses that tell them that they might talk loud in their sleep. Some people may move around a lot and be very active in their sleep. In more severe cases of REM sleep behavioral disorder, bed partners may get hit or pushed or kicked when they're sleeping at night. So usually the care partner is complaining a little bit more about this problem than the patient might. In more advanced cases of this or severe cases of this, there's actually been injury at sleep time. So one case, I had a patient who actually had a dream that he was diving and he dove out of his bed and unfortunately broke his collarbone on his nightstand. So these are the things that really tell us that there's something going on that might be indicating that there's a motor problem that might pop up over time. Constipation is one of the other early signs of Parkinson's disease. And, as we talk about how Parkinson's affects the body, we find that the muscles, again, aren't moving the way that they're supposed to. And that can also happen in the automatic part of the nervous system that's supposed to work without us telling it to work. And constipation can happen. We define that as having lack of bowel movement for 3 days or more. And so when we're finding that people are having this problem, it can be early in the diagnosis, but also can happen as Parkinson's advances over the years. So just a part of that motility of the GI tract that we really have to make sure we're paying careful attention to. Some of the motor signs, the movement-related signs of Parkinson's disease that we see early, first is tremor. And what's unique about the tremor in Parkinson's disease is that it is a resting tremor. So oftentimes people are concerned if they do have a little bit of shaking or tremor of their hands. But we find with Parkinson's disease that tremor happens when you're sitting still, resting, not doing anything, and it's persistent, meaning it doesn't go away after a couple of days and doesn't come back. The tremor does kind of hang around. We find that it's not as typical as another condition called essential tremor, where you have shaking of both hands, and then it happens when you're trying to eat something or drink something or use your hands. That's a different type of tremor. The tremor that we have in Parkinson's is a resting tremor. It is often present on one side of the body first, and then may progress to involve the other side. So this can be present in the hand. It can also be present in the leg or foot, and even the chin or face can have tremor in early stages of Parkinson's disease. We also have trouble moving or walking. And in the neurology field, we call these concepts bradykinesia, which means slow movement, or rigidity, that means stiffness of movement, stiffness of muscles. And so we can see that when we're examining people, if they're concerned about Parkinson's disease. But again, this is different from stiffness that might come with arthritis or other parts of the aging process. And slowness, and when I talk about slowness, I mean taking much longer to do tasks that used to be a lot easier to do. So getting dressed, getting ready in the bathroom, getting out of the door, because movement is a lot slower. Walking can be a lot slower. So these are things that we're looking for when we're concerned that someone's got early signs of Parkinson's disease. Another pretty visible sign that people tend to be bothered by is small handwriting. We call that micrographia. So people often see this when they're trying to write usually greeting cards or something for their family members and friends. They used to have really big brush strokes and able to read their handwriting very clearly, but that handwriting becomes really small and gets smaller the more that you write. I've often had patients say that the bank has had to call them about checks because they're not sure if this is the patient's signature as it's changed over the years. And so that's something that can be frustrating when people can't read what they wrote and their handwriting changes quite a bit. One of the other motor signs or cardinal features that are very visible is what we call a masked face. And that kind of can be termed as like a poker face. So that facial expression is pretty muted. You know, there's not a lot of smiling or frowning either way. Sometimes it might seem that the person's not as engaged in the conversation, but really it's the stiffness of those facial muscles that end up impacting them. It might change the way that their facial expression looks. Some other early signs that we look for and talk about if we're concerned about Parkinson's is dizziness or fainting. This comes from a problem called orthostatic hypotension. And again, there's that automatic part of our nervous system that works without us having to think about it. And that can also involve the heart and the way that the heart works. And so when we're sitting down or lying down, our heart doesn't have to do that much work. But when we go to stand up, our blood pressure can drop. And that's a condition called orthostatic hypotension. The goal is for the heart to beat faster, to perfuse more of the body. But in Parkinson's disease and other conditions, if you have orthostatic hypotension, then it's harder for your heart to do that automatically. We see very commonly that people have been on blood pressure medications for a very long time, but we have to reevaluate how necessary they are, especially if the blood pressure is getting pretty low and might be causing this dizzy feeling. In severe cases, this can be syncopal or can cause fainting to happen. So it is something we want to know about as soon as possible so that we can try to, shape treatments the way that they should around this. Sometimes the medications that we use to treat Parkinson's disease can also cause this problem. So that's why it's important to have expert care so that everyone knows that this could potentially happen and be talking to you about it every step along the way. Stooping or a hunched over posture is something that's also quite common. We see that people's family members or friends may complain that their head is facing the ground when they're walking. It's commonly when we see this stoop posture is during ambulating. They just, have trouble picking their head up totally. Again, that comes from the rigidity of the muscles that are affected in Parkinson's disease. And then we also know that a soft or low voice is very common. And we call this hypophonia, but just a reduced ability to project the voice. We often hear care partners saying that they have trouble hearing their spouse or loved one with Parkinson's disease, but the person with Parkinson's says they just have a hearing problem. And really, there is some change in the way that the voice volume is and how it projects. So that is a very common sign that we're trying to treat as early as possible to make sure that it doesn't become a big communication problem later. So after reviewing those common signs, very common question is, well, what should I do if I am concerned about these symptoms? The first thing is absolutely to talk to your primary care provider about it. They'll talk to you in the context of things that they know are already going on with you medically. For example, if you have arthritis, a lot of the times you might be stiff, you might be a little bit slower. If you have some impingement in your spine, that could be a reason that you may have tremor or shaking. So they're going to talk to you about what other conditions you have that might look like Parkinson's disease, or if medications that you're taking might be causing some of these symptoms to pop up. But if not, they're going to want to refer you to a neurologist just to take a second look at things and make sure that this is something that we should be talking about. If you don't have a primary care provider, or you just want to know what else you should be looking for, or things that you want to make sure that you're addressing in your visits, the Parkinson's Foundation has a helpline that is extremely helpful in navigating anything that has to do with Parkinson's disease. That number is listed there, 1-800-4PD-INFO, but can easily refer you to local resources in your area. If you're just not sure whether or not you've got a neurologist that knows Parkinson's well and you want to know what your options are, or if you want to get involved in Center of Excellence or specialty care, they can point you in the right direction. Super helpful resource. And then also reach out to your network. If you have family or friends or other loved ones that may have been affected by Parkinson's disease, you may really have already a shoe in the game and a real reason to start reaching out to people who know Parkinson's disease quite well. One of the things that I also wanted to make sure that I mentioned today, I know there was an excellent panel about this earlier today, is the importance of clinical research. And, we as a population are underrepresented in so many ways. But really in Parkinson's disease, we find that being able to target treatments to people who need them the most is so important, because this disease is so individualized. So it's really, really important to participate in these opportunities with clinical research, because we know as a community, we have been the target of many things that have not been correct in the way that research is administered. But there have been many ways that we have tried to regulate this, try to change the scape of clinical research. I really think it's important to understand that having an opportunity to represent ourselves and our community only allows us to shape care in better ways. Also making sure that we have the treatments that we need, making sure that we have the resources that we need that are unique to the Black community. There's just so many reasons that clinical research is important. And especially in a condition like Parkinson's that does not have a cure right now, we have a really unique opportunity to participate in things that could be revolutionary in the future. So just to talk a little bit more about resources, again, the Parkinson's Foundation is great in developing these for the large international community with Parkinson's. Their goal is to improve care with everyone that has Parkinson's disease, but also advance research toward a cure. And that, of course, would be our goal with any disorder, but specifically in Parkinson's disease, to find a way to care for people better or slow down or stop the progression of this disease. And also the educational resources that the foundation have really allow us to know what we're dealing with and what's important to know over time. Parkinson's is a very rapidly evolving field. And so being able to keep up with everything that's fresh and current, the Parkinson's Foundation is a really good resource in making sure that you've got accurate information as time goes on. So this is just a couple of key things that they offer. PD Generation is actually a genetic testing initiative that is research oriented. This allows for free genetic testing and genetic counseling if you're curious about whether or not you're at risk for certain genes that could lead to Parkinson's disease, or if it is in your family and you just want to know whether or not you've got any genes that would make you more susceptible. So that is completely free. There's no cost to you, but an easy way to participate in research right where you are in your home. Also, the helpline, as we've discussed, there are tons of fact sheets and publications. A lot of things focus on exercise, which is extremely important in Parkinson's disease, probably one of the more important things that we have and know that people should be doing. So, there's plenty of information about that. Also, if you're newly diagnosed or know someone that was recently diagnosed with Parkinson's, there's a kit in there that's got a ton of great information and resources for people just to overview things so it doesn't seem as overwhelming and you know where to go if you have questions. The last thing, which is one of my favorite initiatives that they have, is the Aware and Care Kit that was designed for hospital safety, which is super important. There are some medications that absolutely should not be given to people when they have Parkinson's disease, or things that they need to know about the hospital stay. So those Aware and Care Kits are also available through the Parkinson Foundation and can be helpful even if you have Parkinson's disease or knows someone who's living with it right now. That can be very, very helpful to their care. So I'm going to stop there and just open the floor up if there are any questions today. Looks like there's a few in the Q&A. So the first question is, how do you encourage people that you see changes in to go to a doctor? This is a great question. And I think for all of those reasons that we discussed, having early diagnosis or soon diagnosis so you can get your care plan as cohesive as you can or as early as possible is really, really important. So just highlighting how, maybe this is Parkinson's, maybe it's not, but we need to see a doctor just to make sure that we know what we're dealing with. And if we can intervene early, that's the best thing. So just making sure that we're answering those questions or explaining to people how important that is a good idea. Another question, does cooking with aluminum foil and pans contribute? This is actually a common question that I get. There has not been any specific research that's shown that cooking with certain materials or mediums can put you at risk for Parkinson's disease. Is there ever a time that medications can play a role in developing or exacerbating the disease? This is another great question. So there is some school of thought that the medications that we give to people who have Parkinson's disease might be causing the disease to get worse over time, or that the medications stop working over time. We know that the medications always work, they're always effective, but the disease itself does progress over time. And with that disease progression, we have to change the treatment plan. We have to increase medication to account for that dopamine loss. And we have to make sure we're doing all that we can to, make sure the symptoms are well managed. So it's not that the medications don't work. They actually work quite well. We just have to keep balancing the medications with the symptoms that people have. Okay, another question. What do you do if your hands shake really bad, but doctors won't test you, more than one doctor? I heard someone say this earlier. I think it's great that if you were going to a restaurant and if you were ordering a dish from a restaurant and it didn't come out quite right, you would definitely send that dish back or you wouldn't come back to that restaurant. And I think that that's 100% true with medical treatment. If you are not getting your questions answered, if you are not getting information that's helpful to you, you absolutely should seek a second opinion. If you're not comfortable with the people that you have gotten this information from, call the helpline, the 1-800-4PD-INFO. We can send you to a person who could be helpful in answering those questions. But that is definitely something that you should keep in mind. If you're not pleased with your care, don't feel bad about getting a second, third, or even fourth opinion to make sure that you get the answers that you need. Another question is, are there preventative measures? What can currently be done to fight back the disease? Exercise is extremely important. I think it's just as important as the medications and the surgeries that we have available for Parkinson's disease. You absolutely have to move your body. You have to move it on a regular, routine basis. The current guidelines are for 30 minutes of exercise a day and taking one day off. So a total of 3 hours a week. So not 3 hours on Saturday, but 30 minutes spread throughout most of the days of the week. This has been extremely, extremely helpful for people who are living with Parkinson's disease important to start early, so it's already a part of your care plan, and you can continue with that as Parkinson's progresses. Even if there are mobility problems, we can modify the type of exercise that you do and how often you do it to make sure that you're getting the most out of that. But it is one of the most important things that we can do to fight back the disease. Another question is, can certain nutrient supplements contribute? We've looked at supplements quite a bit in Parkinson's disease. Often those supplements are things that, have been looked at to slow or stop progression. We've looked at creatine, we've looked at coenzyme Q10, we've looked at a host of other supplements that are out there on the market. We haven't found that one definitive thing that can completely slow down and stop progression in very large groups of people. That is something that we're still working on, but we do know that there are some things like melatonin that can improve sleep and other things like that. The final question I see is, why is it important to get diagnosed early? And what kind of treatments are there for Parkinson's disease? And we've talked a little bit about that, but the main reason why it's important to get diagnosed early is so that we can start the treatment plan as soon as possible. So we get expert care and that it's given in a timely fashion. And I can't reiterate enough how important that is. Okay, so I don't see any other questions. I just want to thank you guys so much for joining today. And please feel free to call the helpline if you have any questions or problems that we haven't discussed. We're always here as a resource for you.